Hi, and welcome to the AI Skills for Doctors course. Artificial intelligence is no longer a future concept, it's already here, transforming how we diagnose, treat, monitor, and connect with patients. As a healthcare professional, you're likely seeing AI in action every day, whether it's clinical decision support tools, automated documentation, triage assistance, or wearable devices tracking vital signs. And yet, most medical professionals and clinicians haven't been given the time, space, or support to really understand how these tools work, or how to use AI confidently and safely. That's the core of this course. AI is becoming part of everyday clinical practice. And while you don't need to become a data scientist, you do need to know enough to evaluate AI tools, ask the right questions, and apply them ethically and effectively in patient care. This course is designed specifically for clinicians and medical professionals, breaking down the key concepts of artificial intelligence, generative AI, and machine learning in a clear clinical language. No coding, no math, just practical, real-world insight into how AI supports your decision-making and strengthens your ability to deliver high-quality care. Let's get started. So, what is the potential of AI in healthcare? AI is transforming the way healthcare is delivered. Over the past few years, AI-powered tools have offered faster and more accurate diagnostics, allowing us to detect diseases faster and with greater accuracy than ever before. For example, in radiology, AI can now identify tumors, fractures, and abnormalities with high precision, and in some cases, surpasses human capability. But AI's impact extends beyond diagnostics. It's enhancing patient care and personalization in the way how we treat patients by enabling hyper-personalized medicine, where treatments are tailored to an individual's unique genetic and health profile. Think diabetes plans tweaked to a patient's unique lifestyle. And let's not forget the operational side. AI is stepping in, easing workload, and preventing burnout by automating documentation, generate patient histories, and handle administrative tasks, freeing up your time to focus on what truly matters, your patients. At an even bigger scale, AI is unlocking predictive analytics, allowing us to forecast disease outbreaks, patient deterioration, and treatment outcomes with remarkable accuracy. As we can see, AI is rapidly becoming a core part of healthcare, and staying informed is no longer optional. AI is here to stay. It's being integrated into hospitals, clinics, and medical tools across the world. Understanding it helps you stay ahead. From practice side, AI improves clinical decision-making and efficiency. It can help synthesize large volumes of patient data quickly, giving you more time for clinical judgment. So, AI helps provide better patient outcomes. From early diagnosis to personalized treatment, AI is enhancing the quality and speed of care. Finally, you need to understand AI biases and limitations. Knowing how AI works helps you avoid blind spots and ensures safer, more equitable use. Now let's move to the course structure. The course is structured into 4 concise and practical modules, designed specifically for physicians and medical professionals. The first module, the foundations of AI in healthcare. In this module, we will cover what is artificial intelligence, machine learning, and deep learning. What is generative AI and how is it different? You'll learn how these systems are built, where they fit in healthcare ecosystem, and why data quality matters. The second module will cover implementing AI in clinical practice, exploring how AI is being used in diagnostics, imaging, remote patient monitoring, virtual assistants, and predictive analytics. We will go through real examples from real tools already in use and share insights on how you can use similar tools today. Then in Module 3, you will learn about AI ethics, regulations, and data privacy. We'll walk through the ethical challenges of using AI in patient care, how bias in AI model impacts diagnosis. We will review the key global regulations you need to be aware of, including GDPR, FDA, and HIPAA. Finally, the fourth module will cover the AI development and deployment in healthcare. You'll get an inside look at how AI systems are developed and validated, From data preparation and training to hospital deployment, this will empower you to better understand how does it work and what questions you need to ask when evaluating AI tools. So the question is no longer, will AI impact my practice? It already has. The real question is, are you ready to use it effectively? I hope you're as excited as I am to explore how AI can redefine your medical practice, enhance patient care, and give you the tools to thrive in this new era of healthcare. By the end of this course, you will be able to decide which tools to use, how to participate in this new era, or maybe design the next tool in AI for patients. Now that you know what's ahead, it's time to dive into our first module, the foundations of AI in healthcare. Let's get started.